70%. I mean, 70% of women will experience the severe physical symptoms we're unpacking today, yet only 7% will actually get treated for it.
It's just a massive failure in modern medicine,
Yeah.
really. I mean, we are letting millions of women suffer through actual anatomical breakdown just because society has falsely labeled this pain as, just a normal, unavoidable part of aging.
Right. Well, welcome to today's deep dive. We are taking a really hard look at a diagnostic landscape that is dangerously misunderstood. And our mission today is to answer one specific question using a stack of authoritative clinical guidelines. What is the exact difference between vaginal atrophy and vaginal dryness?
Yeah, and to give you the clearest picture, we're cross-referencing data from the British Association for Sexual Health and HIV, Harvard Health, the British Society of Sexual Medicine, and the NICE guidelines.
Exactly. And we're going to show you why knowing the difference between a temporary symptom and a progressive syndrome completely changes how you approach your health. Because once you understand the underlying biology, the silence around this topic just seems absurd.
Completely absurd.
So let's start with the term you probably hear most often, which is vaginal dryness. The biggest misconception here is that dryness is a diagnosis. It's not. It's really just a symptom.
Yeah, if you look at the medical definition across all these guidelines, vaginal dryness is strictly descriptive. It literally just means there is a lack of lubrication and moisture in the vaginal tissues at a given moment.
Right.
And it can strike at literally any age. The causes often have absolutely nothing to do with menopause.
Yeah, the sources highlight triggers that, honestly, they actually caught me off guard. I mean, obviously, there are periods of hormonal fluctuation, right? Like breastfeeding or recovering from childbirth. But certain daily contraceptive pills can trigger it. Even medications you grab from the pharmacy without a second thought, like over-the-counter antihistamines or prescription antidepressants.
Right. Think about what an antihistamine is doing biologically. You take it to dry up a runny nose, to block a histamine response.
Yeah.
But the medication doesn't have a targeted GPS system just for your sinuses. It's a systemic drug that dries up mucous membranes throughout your entire body. And the vaginal tissue is a mucous membrane, so it just gets caught in the crossfire.
Wow. Okay, so it sounds like we're treating vaginal dryness the way a bad driver treats a check engine light.
Exactly.
We just put a piece of tape over the dashboard instead of, looking under the hood. Dryness is the light flashing. Sometimes the fix is as simple as just swapping out an allergy medication.
Or even changing your shower routine.
Oh, right.
Yeah, the guidelines specifically call out environmental irritants like perfume soaps, bubble baths, and douching. The chemical composition of those products, they aggressively strip away the natural moisture barrier of that delicate tissue.
Just washing it all away.
Right. And then you also have medical conditions like Sjögren's syndrome, which is an autoimmune disorder where the body's fluid-producing glands misfire and literally stop creating moisture altogether.
Okay, so if simple dryness is just the check engine light, we need to look at the actual blown engine.
Yes.
The underlying structural collapse that triggers that light constantly in mid to later life. And historically, the medical world called this vaginal atrophy.
Right. And vaginal atrophy is a chronic, progressive, cellular change. It is directly triggered by a dramatic drop in systemic estrogen.
Which is usually menopause.
We typically associate it with natural menopause, yeah.
Yeah.
But it can happen overnight in surgical menopause if the ovaries are removed or as a direct result of estrogen-suppressing cancer treatments.
And the physical reality detailed in these clinical guidelines, it's intense. I mean, when that estrogen drops, the tissues don't just feel a little dry, they fundamentally alter.
They do.
The walls of the vagina thin out, they lose their collagen and elastin, so the tissue is, no longer stretchy or resilient.
Yeah, and you also lose the rugae.
Yeah.
The rugae.
Rugae. They are the accordion-like folds of the vaginal wall that allow it to expand. Without estrogen, those folds smooth out entirely.
Wow.
The physical architecture of the tissue just flattens. And because the tissue becomes paper thin and lacks healthy blood flow, it turns incredibly fragile.
The sources mention microtears, right? Like just from everyday movement.
Yes, clinically known as petechiae. The tissue can tear and bleed from minor friction. I mean, even just from walking or sitting, let alone intercourse. And the structural changes can even extend to the external genitalia, causing the labia minora to literally resorb or shrink over time.
I have to point out, though, how terrible the medical bedside manner is here. Handing someone a diagnosis of vaginal atrophy, it sounds grim, it sounds final, and, I don't know, vaguely insulting.
Well, the medical community eventually agreed with you.
Good.
Yeah, the word carries a heavy stigma, but more importantly, it's just clinically inaccurate. It completely misses a massive part of the problem.
That's why, in 2014, the terminology was officially changed from vaginal atrophy to genitourinary syndrome of menopause, or GSM.
GSM, genitourinary syndrome of menopause. I mean, it's a mouthful, but it forces you to acknowledge the urinary tract. Because estrogen receptors aren't just located inside the vagina.
Exactly.
They are densely packed in the urethra, the bladder trigone, which is the base of the bladder, and throughout the pelvic floor muscles.
Right, so when your systemic estrogen drops, your bladder takes a massive hit. The lining of the urethra thins out precisely the way the vaginal walls do.
Oh, wow.
And the smooth muscle of the bladder weakens. This triggers a cascade of urinary miseries that women often assume are just isolated issues. Recurrent urinary tract infections, sudden urgency to urinate, and incontinence.
So GSM captures the reality that the genital and urinary systems are intimately linked.
Yes, and they are both starving for the exact same hormone.
Okay, we understand the gross physical tissue changes now, the thinning, the bladder weakening. But to really grasp how GSM is a completely different beast than simple dryness, we have to zoom down to the microscopic level.
We do.
We need to look at the vaginal microbiome.
Yeah, the biological chain reaction that keeps the vaginal ecosystem healthy is highly regulated, and estrogen runs the entire supply chain. Estrogen stimulates the epithelial cells lining the vagina to produce a sugar called glycogen.
Okay, and that glycogen feeds the local bacteria.
Specifically, it feeds the beneficial bacteria, primarily the lactobacilli family.
Right.
As lactobacilli consume the glycogen, they produce lactic acid as a byproduct. This keeps the vaginal environment highly acidic, usually sitting at a pH of 3.5 to 4.5.
Which is pretty acidic.
It is, and that acidic environment is an aggressive defense mechanism. It makes the area highly hostile to pathogens and bad bacteria.
So when estrogen plummets due to GSM, that entire supply chain just gets boarded up. No estrogen means the cells stop producing glycogen. Without glycogen, the good lactobacilli starve. And without the lactobacilli producing lactic acid, the vaginal pH spikes into an alkaline state, completely dismantling the local immune defense.
And an alkaline environment opens the door wide for bacterial vaginosis, or BV.
Right. And our sources make a crucial distinction here that you really need to look out for. People constantly confuse BV with thrush, which is a yeast infection.
Yeah, they're completely different microscopic battles. BV thrives in this new high pH alkaline environment caused by GSM. It presents with a thin, grayish discharge and a very distinct fishy odor.
Whereas thrush, or candida, is yeast-based, right?
Right. Thrush presents with intense itching, redness, and a thick white discharge. Thrush is an overgrowth of yeast, whereas BV is a fundamental structural shift in the bacterial guard.
Which exposes exactly why telling a woman with GSM to just, go buy an over-the-counter lubricant is biologically illogical.
Oh, completely.
If your entire bacterial ecosystem has collapsed and your tissue is thinning out, lube isn't going to fix it.
A standard lubricant temporarily manages mechanical friction. That's it. It does absolutely nothing to restore the lost ecosystem. It doesn't bring back the glycogen, it doesn't feed the lactobacilli, and it doesn't fix the pH balance.
You're just applying a temporary physical slip to a deep biological deficit.
Precisely.
This brings us directly into how we match the treatment to the actual problem. Since we've clearly separated the symptom of dryness from the syndrome of GSM, the treatments are entirely different. So let's tackle managing simple dryness first.
For short-term dryness, you look at non-hormonal options. Lubricants are designed purely for friction relief during sexual activity or pelvic exams. They come in water-based, silicone-based, or oil-based formulas.
But you have to be careful with the chemical makeup here. Harvard Health notes that some high-osmolality water-based lubes can actually pull water out of your cells, causing more damage.
Oh yeah, and if you use oil-based lubes, they will instantly degrade latex condoms.
Plus, I saw that petroleum jelly, like Vaseline, is a strict no-go internally.
Absolutely. It doesn't wash away easily, and it traps bacteria against the tissue, which makes infections far more likely.
Okay, so beyond lubricants, you have non-hormonal moisturizers, which are entirely different.
Right. You use them as a regular maintenance routine, kind of like a daily face cream, not just in the moment of need. The most effective ones are formulated as bioadhesive gels.
How exactly do those work differently than lube?
Well, they're made of cross-linked polymers. So when you apply them, they physically attach to the epithelial cells on the vaginal wall, and hold onto water molecules. This creates a continuous layer of hydration that stays trapped against the tissue for a couple of days, just slowly releasing moisture.
Oh, that's clever. Okay, so moisturizers and lubes handle the check engine light. But if we want to fix the blown engine, the tissue collapse of GSM, we have to look at hormonal options.
Yes.
Across all the clinical guidelines we're reviewing today, the gold standard is local vaginal estrogen.
Right, and it comes in creams, tiny tablets, or flexible rings that release the hormone slowly.
But if this is the gold standard, why do these sources emphasize that it's one of the most chronically underprescribed treatments in all of gynecology?
It really comes down to a lingering, pervasive fear of systemic hormone replacement therapy, or HRT. Patients, and honestly even some doctors, are still operating under the shadow of highly publicized, misinterpreted studies from decades ago regarding breast cancer risks and systemic hormones. But local vaginal estrogen is fundamentally different from taking an HRT pill or wearing a high-dose patch.
Because it doesn't flood the whole body.
Exactly. The dosage is incredibly low. It's absorbed directly by the local tissue receptors in the vagina, urethra, and bladder. There is minimal, if any, systemic absorption into your general bloodstream.
And the restorative effects the guidelines describe are incredible. It doesn't just soothe the dryness, it re-engineers the tissue.
It does.
It thickens the thinned-out epithelium. It triggers revascularization, meaning it prompts new blood vessels to grow, bringing oxygen and blood flow back to the area.
Right.
And it turns the glycogen production back on, feeding the lactobacilli and dropping the pH back to that healthy acidic level.
It physically rebuilds the wall and the ecosystem simultaneously. Now, for cases where local estrogen isn't preferred, there are advanced alternatives. One is a DHEA insert using an active ingredient called prasterone.
How does DHEA differ from putting estrogen directly on the tissue?
Well, DHEA is an inactive precursor hormone. When you insert it, the local enzymes inside the vaginal cells convert that DHEA directly into active estrogens and androgens right there inside the cell.
Oh, wow.
Yeah, it's essentially delivering the raw materials and letting the local tissue manufacture its own hormones with virtually zero leaking into the general circulation.
That's fascinating. And you also have an oral non-hormonal medication called ospemifene. The guidelines classify this as a SERM, a selective estrogen receptor modulator.
Right. A SERM acts like a highly specific chemical key. It's shaped perfectly to unlock the estrogen receptors in your vaginal tissue, turning on the signals for blood flow and tissue thickness.
Okay.
But it is the wrong shape to unlock the estrogen receptors in breast tissue. In fact, it acts as an antagonist there, blocking the receptor. So you get the local vaginal benefits without stimulating breast tissue.
Which naturally brings us to the very specific protocols outlined for breast cancer survivors. For a woman whose cancer was fueled by hormones, the word estrogen sets off massive, understandable alarm bells.
Of course. And the clinical protocol for breast cancer survivors requires tight collaboration between the patient, their gynecologist, and their oncologist.
Right.
The guidelines dictate starting with non-hormonal moisturizers and lubricants. But if those failed to provide relief, local vaginal estrogen can often be prescribed safely, particularly if the cancer was estrogen receptor negative.
Because the systemic absorption is so low.
Exactly. The systemic absorption is so low that the massive quality of life improvements often heavily outweigh the theoretical risks.
Yeah, no one should just be told to deal with it. There are highly targeted, safe options available.
And we really have to stop dismissing this as purely a sexual intimacy issue. Society hears the medical term for pain during sex dyspareunia and writes GSM off as a private bedroom problem.
But having thinned, fragile, unlubricated, inflamed tissue means you are experiencing acute pain doing incredibly mundane things.
Yes.
Clinical surveys in these guidelines show women reporting severe pain when walking, cycling, or, simply sitting in a chair for a long period.
It's a constant, daily physical discomfort that severely impacts mobility and mental health, regardless of whether a woman is sexually active. And unfortunately, many common daily habits actively worsen the condition.
The lifestyle culprits. The guidelines call out wearing tight synthetic clothing.
Oh, yeah.
It creates a restrictive, non-breathable environment that traps heat, which compromised skin hates. Wet wipes are another major issue. The preservatives and fragrances act as massive chemical irritants.
Definitely.
Talcum powder is a strict no-go. Even your laundry fabric conditioner leaves a chemical residue that can trigger an inflammatory response in that sensitive tissue.
And one of the most fascinating culprits mentioned in the sources is actually smoking.
Yeah, we know smoking damages lungs, but it directly impacts GSM because nicotine is a potent vasoconstrictor.
Right.
It physically narrows your blood vessels. When your vaginal tissue is already starved of circulation and oxygen due to low estrogen, smoking just chokes off whatever minimal blood flow is left.
It really does.
Yeah.
But the hidden impacts go far beyond daily discomfort, though. The British Society of Sexual Medicine guidelines highlight a deeply troubling trend. Untreated GSM is actively preventing women from getting preventative care. Many women are outright canceling their cervical screening appointments.
Because untreated GSM makes the insertion of a speculum for a smear test agonizingly painful.
Exactly. The tissue is so fragile it tears, so they just stop going.
Wow. Let's pull all of this together. The core takeaway from today's deep dive is that you have to demand a precise diagnosis. Vaginal dryness is a symptom. It's the check engine light indicating a lack of moisture, and it can be caused by anything from antihistamines to perfumed soap.
But genitourinary syndrome of menopause, or GSM, is a chronic, progressive, anatomical breakdown of the genital tissues, the urinary tract, and the microbiome, driven by systemic estrogen loss.
You can manage temporary dryness with friction-reducing lubricants or water-trapping bioadhesive moisturizers, but you cannot cure GSM with a tube of lube. You have to restore the physical architecture and the bacterial ecosystem, typically with targeted, low-dose, local hormones or SERMs.
Understanding this distinction is really the key to treating the actual root cause, rather than just masking the pain.
We've talked extensively about how this affects personal health, mobility, and intimacy, but think about the broader economic and societal impact. How many women are quietly stepping back from their careers, turning down promotions, or retiring early in their peak earning years in their 50s simply because sitting at a desk all day or commuting on a train is physically agonizing?
It's tragic.
And they make those massive life-altering decisions because a doctor never took the time to tell them there was a local low-dose fix. And worse, going back to what you said about the speculum pain, it really makes you wonder how many entirely preventable cases of cervical cancer are slipping through the cracks right now, simply because the medical world and society at large are just too embarrassed to talk openly about vaginal health.
It completely reframes the conversation. We aren't just talking about comfort. We are talking about women's ability to fully participate in their own lives and careers without chronic, unnecessary pain, and their ability to get life-saving preventative care.
Thank you for joining us on this deep dive. Keep asking the hard questions, push past the awkwardness, and demand the precision you deserve for your health.